Okay, guys, moving into the ophthalmic drugs, I'm going to do the exact same thing. I know what they have literally asked a few questions since I took my boards in '92, so they still ask those. I'm going to get to those. When we're looking at the anatomy and physiology of the eye, I just want to point out glaucoma because we've mentioned that several times throughout our semester about how different medications are contraindicated with individuals with glaucoma. So think about glaucoma having that additional pressure in the eye, and we don't want to take any other medications that would increase that pressure of the eye. Okay, I think we'll go down on that one. Tells you a little bit about that. Tells you a little bit about eye. Going back to your A&P that you've had. That intraocular pressure is something that you need to be aware of, so we want to decrease that intraocular pressure typically. They give you some good terms here. Mydriatics dilate the pupil. Miotics constrict the pupil. I would understand or memorize that term because if you see a question that says mydriatics, you need to understand that it dilates, and to me that's real easy. It's got the D in there for dilate. And then constrict is just the opposite. So O for constrict and O over here for that one. Those are the two that I've seen in questions. Talks a little bit about that glaucoma pathophysiology, so understanding that. And usually I want you to think about that increased pressure in the eye, which will obviously, as it mentions over here, impair the vision. Anti-glaucoma drugs, it'll talk a little bit about those. A little bit about cholinergic medication, so with our miotic, so keep in mind that's going to do just the opposite of our anti-cholinergic drugs that we've talked about throughout the semester. Scroll down. And it gives you pilocarpine for our cholinergic drugs for the treatment of glaucoma. That seems to be one that we might see frequently, although the question isn't necessarily on what it does. The question is actually on how we give it, so I'm going to scroll to that. So even though they've got all this information about the different medications for eye issues, typically thinking about getting down that osmotic pressure, I'm going to go all the way to the end of the chapter till we look at these nursing care plan, nursing process. Okay, when we get to that nursing process, we're having to perform that baseline assessment of the eye to see what's abnormal, note any redness, note any drainage, and note their visual acuity. So that's a key indicator there. Understand the mydriatic is for the dilation, while the miotics is for constriction. So keep that in mind. We're going to scroll past here. When we're thinking about implementation, this is the question somebody will get. When you're giving ophthalmic medication, tilt that patient's head back, have him look up to the ceiling. We're going to drop that into the conjunctival sac, making sure that we don't touch the tip of the applicator to the eyeball itself. And then if we have to do multiple medications, making sure that we give 5 minutes in between each, and then placing your fingertip over the inner part of the eye to prevent the eye drop from being absorbed systemically. So those are the questions that somebody's going to get on ophthalmic medication. They usually don't ask what the medications do other than understanding the miotics are constriction and mydriatics are for dilation. They usually ask about the implementation and how you give that eye drop. The other thing I've seen with that is if the eye drop has to be kept in a refrigerator, that you want to sit it out for about an hour before you give the eye drop. And it's very common that after the eye drop, after you've instilled the eye drops, that the eye is irritated for a brief amount of time. That's typically normal, and we'll tell them to keep their eyes closed. You can put something over their eyes, but that irritation should go away within 10-15 minutes, so it shouldn't be a prolonged irritation. And then your evaluation is going to be, do they have better vision? If they've had an infection, is the infection clearing? If we have any inflammation, is that inflammation going down with that? So that's all for the ophthalmologic chapter.